Furosemide certainly is used in this disease. I'd like to point out that it's a mixed bag, meaning that if you look at the chart to your left, we've got 5 parameters. We'll start at the bottom of the slide and look at aldosterone levels, and you can see that in human patients treated for heart failure, that furosemide activates aldosterone, meaning that aldosterone release is increased with furosemide. That shouldn't be surprising to us because we alter renal blood flow, thereby activating the RAS system. As also part of this, we see that angiotensin II and plasma renin activity also rise in these patients treated with the loop diuretic furosemide. We see at the top of the slide that cardiac output falls, as we've already discussed, as we reduce preload. The Frank-Starling law suggests then that cardiac output will fall, and I'm using this slide to show you that yes, indeed, it really does. Lastly, circled in red is the pulmonary capillary wedge pressure, which is a measurement or an estimation of left atrial pressure. Left atrial pressure is the driving pressure that gives you pulmonary edema, as you see in the dog on your right who has fulminant pulmonary edema. So what happened to the wedge pressure in dogs that received, in people that received furosemide? We see there was a dramatic fall in this wedge pressure. So while it did some things we don't like, it also will save the patient's life. Chronically, it will reduce the symptoms. Looking then at the effect of loop diuretics, as you can see here, furosemide is the one that we most often use. It's the one that's approved for use in dogs. It works on the ascending loop of Henle, but we need to recognize that it activates the RAS. It can produce hypotension and azotemia. It does reduce cardiac output as part of its mechanism of action. And it can result in hypokalemia and hypomagnesemia, which will increase our chances of arrhythmia. And the take-home point from this is we need to use it at the lowest possible dosage to maintain our patients free of clinical signs.